I'm here today to introduce Dr. Selwyn Vickers, the James C. E. Lee Jr. Endowed Chair, Senior Vice President of Medicine, and Dean of the UAB School of Medicine, for his State of the School of Medicine address. Dr. Vickers has played a pinnacle role in providing strong, enduring, and progressive leadership during his time at UAB. From meeting him at the White Coat ceremony to kneeling beside him at the Black Lives Matter for White Coats event, Moment of Silence, Dr. Vickers has consistently facilitated the growing diverse and inclusive environment here at UAB. He advocates for student scholarship initiatives and has accelerated social justice progress to propagate much needed conversations and changes at UAB. He's been an inspiration to myself and many others. It's my pleasure to turn this over to Dr. Vickers.
Thank you, Ali. I appreciate the introduction, and I appreciate you taking the time to actually come and introduce me and introduce this State of the School address. This is a day I look forward to in many ways, to update our community, to recognize our leaders, and to really thank broadly all of our community members for the hard work that they've done. This year is like none other, and you've heard that frequently, but practically as it relates to this talk, this year is also affected of what and how we will deliver this. It will be done in a standard way, but normally we go through and recognize our leadership, our faculty, and their accomplishments and move directly into each of our mission areas. This year we have a section distinctly for COVID-19 of how we've worked together to impact our world by virtue of the talents we have at UAB. So I'm looking forward to going through this and looking forward to hopefully giving a chance to give recognition to many who worked extremely hard. So putting this together is no small feat. I really do want to thank our communications team. Paige has led the way with a great team, including Jessica, Tyler, and Mary Ashley. They've done a phenomenal job. I appreciate all the work in the Dean's office, for our leaders at the School of Medicine, Dr. Agrawal, Dr. Benevenisti, Glenda, and Kim, and Alexis. Thank you all for all the hard work you've done in pulling this together. So as I mentioned, this is slightly different, but let's move into it and talk about the things that are really important for our community. It's first, we need to thank the UAB community in its entirety. There have been so many of you who've pulled together in this pandemic to make a difference for first UAB, but also for the state of Alabama, Birmingham, and beyond. Thank you all for your perseverance. In many ways, it feels like we're in the 13th month of 2020. Doesn't feel like we've gotten truly into 2021 yet, but through it all, we will persist and we will come through this stronger and better. So thank you for what you've done. Each year, we unfortunately have to take time to recognize those of our community that we've lost. In addition, this year, there have been so many we've lost due to COVID-19. Over 6,000 deaths in our state, over 400,000 deaths in our country, and nearly 2 million in the world. Let's take a moment of silence, both to recognize those dear friends who were part of our community who are no longer with us, but also for those who have lost loved ones personally, and those who've been lost in our state and country. Thank you for doing that. Again, I want to thank the leadership of our university. President Watts has been a phenomenal leader during this time, both visionary, disciplined, and concerned about the entire community. His supported staff have been outstanding, but most of all, his co-leaders with Dr. Pam Benoit and Alan Bolton have been instrumental, particularly on our academic side and putting together the broader picture for success within the broader UAB community. Thank you all for your leadership that will be needed throughout the rest of this year. I also want to thank our clinical and health system leadership. Dr. Fernandi now sits as the CEO of the UAB St. Vincent's Alliance, And that's been a pivotal amount of work that he's continually do to bring these two enterprises together and to grow us to bigger and better things. But I want to thank Reed Jones now, who's taken over as CEO of UAB Medicine, and Dr. Tony Jones, who's moving forward in a very strategic manner as the president of our practice plan. Thank you all for your hard work and leadership. We have 4 new chairs, and we're excited about the additions of leadership to our departments. Dr. Werner Ha, who's well known to our community, but internationally known surgical gynecological oncologist, is our new chair. Werner, welcome. And Dr. Adrian Lottie, who did a phenomenal job as our interim. Dr. Hum, I must admit, was facilitated by Dr. Todd Jenkins, who served admirably for the interim role. Dr. Lottie was in the interim role in psychiatry, and it was clear in short order that she should be the next chair. And we're excited that she accepted. She's a well-funded researcher focusing on psychosis and physiological imaging of the brain. Our new outside chairs are in 2 areas, in genetics and emergency medicine. First is Dr. Anindya Dutta. Dr. Dutta hails from the University of Virginia, where he was the chair of the Department of Molecular Biochemistry and Genetics. He's a well-renowned geneticist who's been one of the early founders of circular DNA. We're excited that he will be joining our community this year. And finally, Dr. Marie Carmel Ellie has just been recently named the chair of the Department of Emergency Medicine. Dr. Ellie hails from New York via Florida, where she was at the University of Florida, and will be joining us this year as well. We're excited about her offer and her acceptance of this position. As it's clear probably from this picture, she is our first African-American department chair, woman department chair at the School of Medicine. We fuel our future through the Pitman Scholars. Dr. Agarwal's leadership and others in our research community identify key young faculty members who are going to be our next stars. This year, there are 10 of them. I won't go through all of their names, but they are outstanding young physician scientists or research scientists who really paint a bright future for UAB, School of Medicine. In addition, we seek to sustain our success by recognizing our internationally renowned senior faculty members through endowed chairs and professorships. These awards truly allow for us to bring sustainability, retention, and also recognition to the hard work and success these physician scientists and research scientists bring to the UAB School of Medicine, the state of Alabama, and our country. We're thankful that our community has continued to support us through philanthropy. I really am indebted to our development team led by Megan Kane that's continually driven forward and engaged our community, often through virtual meetings, to raise over $59 million in 2020, and with specific dollars toward basic science, precision medicine to help our research in this COVID pandemic. This is a snapshot of who we are as a community. You're not surprised the numbers are significant, and they really belie one of the great and largest academic medical centers and schools in the country. I want to thank Dr. Rogers for his efforts in leading our Dean's Excellence Awards. These Excellence Awards are in the areas of diversity, research, teaching, service, and mentorship. And each of these individuals you see have excelled in one of these areas, and they're recognized for it, as you can see on the slide. It gives us great privilege and honor to really thank them for their efforts above and beyond the regular call of duty, if you would, and the recognition that their peers have bestowed upon them. It was exciting this year to work with Dr. Agarwal through his role as president of the American Society of Nephrology, one of the largest professional societies in our country with over 22,000 members. They've been active in affecting legislation for kidney disease and chronic disease in this country. We were proud to participate in his presidential address and his journey to this role. Dr. Sherry Cannon is only the second female president of the American Society of Academic Radiology department chairs. She is a leader nationally in numerous organizations, but this is a tremendous honor for Sherry. Congratulations. And finally, Dr. Benjamin Larimer was selected as one of our NIH Director's New Innovators Awards. This is a prestigious award given to young faculty members who've demonstrated that their research activity and their focus has a chance to truly make a difference for our overall medical community. Congratulations, Ben. Dr. Steve Rowe and Amit Gagar were admitted to two of our most prestigious societies. Steve to the Association of American Physicians, which is one of our most prestigious senior physician scientist organization. And then Dr. Gagar to the American Society of Clinical Investigation, really the place where rising stars and stars that have already shone brightly have been admitted to this organization to be future leaders of clinical research. Dr. Victor Sun was named chair of the Huntington Disease Society of America as the head of their National Board of Trustees. This is the leading national organization that seeks to make an impact in the difference of lives of patients suffering from Huntington's disease. Congratulations, Victor. So as I mentioned, we are going to look at what we've done together. And together we have made an impact and we can continually make an impact. Specifically, we'll speak about the unique things that we've done as relates to COVID and then work through each of our mission areas, which are quite unique for this year. So many have said that necessity is the mother of invention. And the GuideSafe platform was something we needed in a major way across America, but particularly for UAB and Alabama. The leaders, including Dr. Sue Feldman, Dr. Kurt Carver, and Mohan Tharamulai, led the way of developing through their own research a platform for an online COVID screening tool for our entire community in nearly 200,000 other places and citizens in our state, as well as across the country, but also building a contact notification app in conjunction with Google and Apple and our Alabama Department of Public Health. Their work was transformative, allowing us to move back safely for our schools and to provide information for our faculty and staff who were all coming into our facility in the midst of this pandemic. In addition, we took on testing for our state, particularly for the re-entry of all of our students and our communities to return in the midst of a pandemic. This effort, led by Mike Sag, Tony Leith, and Bob Phillips, was phenomenal, where they put together a team of tacticians, logistics leaders to test over 100,000 students in partnership with Verily, as well as with the colleges across our state and the UAB campus. This testing would not have occurred without multiple groups. First, this one for our on-campus sentinel testing, led by Dr. Agarwal, Jordan DeMoss, Jay Locks, and Barbie Vanderpool. And then for our pathology department that stood up the testing capacity from doing only about 1,000 a day to the capacity to do well over 10,000 tests a day to allow us to pull this off. This effort was led by Dr. Sixto Alil and George Netto, as well as Dr. Vanderpool's lab as well. We also continue to try to impact our disparate and underserved communities. Live Health Smart Alabama launched 112 testing sites around Jefferson County in those areas that were affected but yet missed a lot of service. In addition, we were awarded a $6.4 million funding grant from Jefferson County in order to increase our efforts of testing in this area. I forgot to mention that this whole testing and GuideSafe effort, I really do have to thank Governor Ivey in our state for the over $30 million grant we received in order to conduct this activity and pull this off. We also then didn't stop for state funding. We went after national funding. The SEAL Award is a $12 million set of dollars distributed to 11 states where they are allowed to impact outreach for our ethnic and racially minority communities in order to make sure they're aware of the opportunities for vaccine, as well as engaged in all of the therapies that can help deal with the disproportionate impact that COVID-19 is having on these communities. We quickly shifted our platform to take care of our community. Prior to COVID-19 in March and February, we saw less than 1% to 2% of our outpatient cases with e-medicine or virtual medicine. We quickly transitioned, like many across the country, to provide that service through Zoom and virtual visits to up to 67% by April of 2020. In addition, we realized that our treatment for these patients was not only around their care in the hospital, and over 3,000 patients have been treated in our hospital, and there's been phenomenal work done by our ICU teams, our hospital medicine teams, our ER physicians, as well as our pulmonologists. They've done phenomenal work in taking care of these patients. But we realize the disease doesn't end when they get out of the hospital. Our COVID respiratory clinic follows the so-called long haulers as long as they have symptomatic illness. In addition, we've started interventional therapy to keep people out of the hospital with the monoclonal antibody clinic that treats patients within their first 10 days. Our medical students have set an example for our entire community. They've stepped up to support in so many areas. They first had to adapt in their own world where much of our training, both in the clinical and the basic science years, had to go all online. And then they stepped in to support our entire community, manning the hotline in the early times of COVID-19, helping staff our testing as well as our vaccination sites. Thank you for your demonstrated effort of service. Our regional businesses join in, delivering over $1.5 million. I really want to thank Dr. Benvenisti and her leadership, but also others with Dr. Chris Brown in the VPR's office that allowed us to set up a platform to fund new projects really without going to the NIH to deal with the critical issues of COVID. We were able to fund 24 projects that allowed our scientists to pursue this and make an impact in this disease. In particular, we really want to recognize Dr. Fran Lund and her basic science efforts to work with Altimmune, where much of the preclinical work related to this nasal delivery vaccine that uses an adenovirus vector may be a great new way to deliver a vaccine as it now enters phase 1 trials. Finally, as it relates to outside visitors, our last outside really central visitor to our campus was Dr. Francis Collins. The day he was here, the first known case of COVID-19 was diagnosed in Bethesda, Maryland. And it was critical because had that been done before his trip, he may not have ever made it to Birmingham. But we were thankful for Francis's visit, where he gave a phenomenal lecture highlighting the top 10 things that really impressed him about where research was going and sharing where UAB was participating in. Again, we had an outstanding research symposium, an effort again led by Dr. Benvenisti and our broader research community, where we had over 2,000 attendees, but we had some tremendous speakers, both internally but externally. Dr. Anthony Fauci was a keynote speaker, as well as Kathleen Newsel, who's one of the preeminent vaccine development research developers in the country. So this day we look forward to, and yet we have a long ways to go. December 15th, we received our first 10,000 doses of the Pfizer COVID-19 vaccine, and we've delivered over 20,000 doses. We have a robust plan internally where we can deliver almost 15 to 17,000 doses a week. We're desperate to get this to the broader UAB community and realize many of you are asking when and why is it taking so long. We're working hard on our internal world, but we're also pushing hard externally to help our state improve its distribution plan. And we're certainly hoping that our administration will be able to deliver on the new doses they promised. We didn't ignore what was going on in the midst of the crisis to unique parts of our community. I had a chance to work with 13 other African-American medical school deans to highlight this crisis within a crisis for our country. Most of us have seen the disparate impact of death and infections that have happened to the minority community, whether Black Americans or Latino Americans. This has been a tremendous devastation to many of these communities. We highlighted this crisis, and it's still a challenge that we face now and that we'll have to address going forward in the future. We were the voice of information, and we were the messengers of hope and detailed data to the world. I highlight the number of our leaders who've given thousands of interviews to the media and who've been made UAB really an internationally known name through their conversation on national networks across the country. Kudos to Dr. Ginny Moratto, who's led this effort in a tremendously professional and proud way for UAB. So we didn't only come together to continue with COVID-19, but we had to pivot to continually work together to drive our mission area in research. And we've done that for over the many years that we've given this talk, and we continued it during this time. We recognize over the last few years, we've grown phenomenally well in a competitive landscape. Over the last 3 to 4 years, over 40% growth in our NIH dollars. And then over the last 6 years, we've increased that growth by 93% to an additional $123 million. That's a lot to be proud of, but it is no time to sit on our laurels. We're growing this because we live in an area of the country where there is tremendous need for our science and data and clinical care to impact chronic disease. And we want to continually impact the broader world and community through the accumulation of outstanding talent and new discoveries. This slide shows that continual slope of growth, but I make you aware that it relates to our ranking. We've leveled off because our growth hasn't been as steep as it needs to be. We'll reignite that fuel to grow this year. Under the leadership of Dr. Benavenisti, Dr. Agarwal, and Dr. Kimberly, we'll re-engage where we need to grow in our research community to reascend to that 10% growth number that we've had in the past. I want to thank Dr. Kimberly for his continual tireless efforts to lead our CCTS during this time period, but particularly to make sure we've continued to not shut down for our clinical trials. Many of these are essential for our cancer patients and our patients with chronic disease. In addition, I'll take a moment to recognize some singular large awards in our research community. Dr. Singh, congratulations on this $7.6 million award for PCARD funding for rheumatoid arthritis. We've worked hard over the last several years to secure this Superfund grant because it was a clear need in our area. I want to thank Dr. Vina Anthony and her team for the hard and tireless work, as well as the support of Dr. Agarwal, our Executive Vice Dean, to pull this off. In addition, Mike, that's Mike Mugavar and Mike said, thank you for a well-run AIDS center that's nationally and internationally recognized that provided the foundation for this $5 million supplement. And again, we've worked over the last 3 years to support the effort by Dr. Roberson and Dr. Standard in neurology to finally acquire one of the Alzheimer's research centers. It's important for our country. This center looks at Alzheimer's research broadly. It's one of the new ones that have been established, but it also looks at our disparate population like none other to answer those questions about what Alzheimer's means within that group as well as others. Congratulations to Dr. Yoder and Dr. Mike. This was a last-minute effort because we knew we needed to do it, to put together a large award for developing animal models for precision medicine. I thank Dr. Yoder for the yeoman effort and Dr. Matt Mike for the vision to secure this $9.3 million grant. Well, as you've heard about all the growth, many of you are aware and know that what needs to also grow is our infrastructure, our support mechanisms, and our cores. I can assure you that this is front and center for our community. I want to thank Dr. Chris Brown and his partnership as the Vice President of Research with our community, again with Dr. Benavenisti and others, to really now make the clear and front and center goal is to provide some of the most outstanding cores and create an infrastructure that can support the best research in the country at UAB. The first step was to appoint a dedicated leader. And we thank Mike Bertram for taking on this role along with his Cancer Center Administrator job. And this will be a place where we invest dollars and we will drive attention and focus to make sure we can support our growing and burgeoning research community. The other area of infrastructure we knew we were tight on space, and we feel it in many areas. This picture is indicative of our investment that we want to change in our physical space. This is what the new McCallum building will look like when it's completed. Some of you have already seen that benefit on the first 2 floors. We're marching through all these other floors to get it redone. This is an $80 million redo of our largest research building. In addition, I want to thank the Steislinger family. They have donated $10 million for the naming of this building, as well as I thank Governor Ivey and the state for the $50 million to finally build out our genomic medicine building that will be great dry lab space as well as a conference center. So we are aware that this is an important area of our growth. We're thankful for all that you've done. We're clearly committed to now building the support structures and having the best space in the country in order to support the growth of this community. Also critical to who we are is our education mission. And every 8 years, we come back to this critical step for our School of Medicine. and that's our LCME reaccreditation. This is our version of the Joint Commission for Accreditation for Hospitals. This is our good housekeeping seal of approval. This is our eligibility to run the race to be one of the best medical schools in the country. Without it, we can do none of those. So you'll be hearing more about this throughout the next 2 years as we work through all of the facets of our LCME accreditation to get prepared to demonstrate that we have an outstanding place for educating the next generation of physicians. We have a dedicated team of leadership led by Dr. Kathy Fuller and Dr. Gustavo Hudeberg. There are other members on this slide who are also crucial, and they will play a critical role throughout this entire period over the next 2 years to get our entire program in place. We recognize our research educators through Enrich Week, so-called previously Rhyme Week. It brings the best of our health educators together. It supports our Health Educator Academy to showcase some of our innovation, to hone our teaching skills, and to make sure we're providing the best platforms to train our scholars and our students. I want to thank Dr. Hudeberg for serving as the initial interim dean, and want to thank Dr. Wick Manny for coming back as we're in the process of finding a permanent dean, which has not been easy during this COVID time period. But thank you, Wick, for stepping up. Thank you for your passion and concern and care about the Montgomery Regional Campus. Shout out to Dr. Ricky Friend for taking on the goal of creating our primary care track pathway at Tuscaloosa for our students. Those students who recognize that's where they want to work with their careers, have the opportunity to train specifically in this space after their first 2 years in Birmingham. And then Dr. Smalley, congratulations on the integrated medical medicine residency that takes the fourth-year students and begins to expose them to the internal medicine process early on and dedicates them to that pathway and that residency throughout their fourth-year School of Medicine. Wellness is important for everybody, but particularly for our graduate medical education community. Our residents work as hard as many in the country and harder than many of anybody in our community. This dedicated space that will begin construction in June will be a clear area where they can go for a reprieve and revive. We look forward to its build out. I thank the hospital and the school for its participation in making this happen under the leadership of our wellness community. Well, at the core of what we do at the end of the day, when it comes to both our education and research, is to impact our patient care. And we truly, like no other time, have had a chance to do that this year. Again, I mentioned the hard work by Dr. Fernani to pull together the St. Vincent's Ascension Hospital system, as well as the UAB health system and UAB medicine, to an aligned alliance now to take on the care of our citizens and to create a platform to further support our broader academic mission. Combining these two probably makes us one of the more powerful health systems in the South. And we thank all of those leaders who worked hard, including our board, President Watts, and again, Dr. Fernani. Our transplant program didn't skip a beat. We performed more transplants in 2020 in the midst of the COVID pandemic than we've done in any time in our history. It puts us well within the top 10 of transplant programs. And had we had the additional ability to do more of our living donors, we probably would have exceeded over 400 transplants. In addition, I commend our radiation oncology department and Dr. Bonner, as well as our health system, in working through and developing our Proton Therapy Center. It's the only one in the state, and it provides a unique level of care for kids as well as for those with tumors that need to avoid some of the side effects of traditional photon therapy. So this entire process laid the groundwork for change. Not only did we suffer through this challenge of COVID-19, but we suffered through the death of George Floyd. That alone shocked America, shocked us here, particularly in Birmingham, where we have a history of working together from our difficult past to make a difference. I want to thank our broader medical community, and I want to thank the courage of our minority community for speaking up about the significant issues that remain for us to deal with. This is both professionally important and personally important for me, as well as our other leaders. This picture demonstrates our solemn commitment to make a difference in this part of our world because it will make a difference and make us better for everybody. We will ask you to begin this hard work with us because it will take us to a uniquely better place. To that end, we've established our Black African American Faculty Association and our Hispanic Latinx Faculty Association. These are going to be powerful vehicles for bringing change, but creating community for each of these groups for success and excellence as it relates to both our healthcare, research, and education. In addition, we've continued to want to impact Birmingham, Alabama, and the broader community. We had a chance to partner with some of our citizens and particularly some of our other academic leaders. Mr. Jeffrey Baer and Dr. Henry Panion were key partners with UAB School of Medicine and our Birmingham Coalition for Human Rights. We took the opportunity to create a documentary and shared this documentary with the world of the visit from the Auschwitz violins to Birmingham and the 16th Street Baptist Church. If you haven't seen it, this is a powerful film. And it was powerful enough that it's been in over 150 media areas throughout the United States, but it now has been around the world from Australia to Amsterdam. And in doing so, it's won more Telly Awards for this visual product than any other in the area of education. So a tremendous amount to be proud of. The WellBeing Index is still a fundamental piece of our success. And I thank Dr. Rogers and Nisha Patel for providing the vehicle, not only of the index, but creating a community where well-being can exist and we can recognize our stresses. So we've learned a lot, and we've clearly learned more than anything else that we can make an impact together. We've learned going forward that if we're going to continually make a difference, we have to be better than the individual components. We have to make the sum of our parts something unique and special. And this year, we've made that very clear. Although in many ways, 2020 ended on December 31st, the impact and the continual challenges of 2020 will carry well into 2021, and we will clearly need to continually make an impact together for UAB, Birmingham, Alabama, and the world. I'll stop with that. Thank you for the opportunity to share, and we'll take questions now. And I'll turn this over to Jessica.
Hi, Dean Vickers, and thank you to everyone who submitted questions ahead of time. My name is Jessica Martindale, and I'm the Director of Communications here with the School of Medicine, and we'll go ahead and get started with your questions. Dean Vickers, the School of Medicine has frequently been the catalyst for the integration of clinical care and biomedical research. What are the plans for the School of Medicine to build upon this historical strength?
That's a great question. You've heard me mention Dr. Chris Brown's name a lot, and Chris is really a critical partner. We've created something called a rapid task force, which really is a research-focused group of key leaders to look at how we make sure we facilitate and expand the opportunities for our research administrative teams to be efficient and effective in getting our clinical translational wards really up and running in an efficient way. We've seen a significant turnaround in our cancer center, and this is crucial for us to be the institution we want to be. So one, we're making sure internally we're providing the basis and infrastructure. Secondly, the world needs us. We have the diversity of populations in our hospital that can answer questions like no other institution. So we're developing a formalized biorepository. Dr. Kimberly is continually fostering the efforts to make sure our clinical trials can be effective and efficient. Dr. Barry Schleckman has now made it very clear that standard of care for cancer patients is our clinical trials. Those phase 1, phase 2 trials that are early new to drugs development, phase 3 trials are essential for the nearly 50 to 60% of patients who fail standard therapy. So we're taking this seriously and making sure we can reach our full potential for translational research.
What are 3 of the more significant changes that the School of Medicine will either continue to institute due to the pandemic?
Yeah, I think one of them is what we're doing now. We will probably continually use this powerful tool of virtual communication more than we've ever thought we could. Now, I think we recognize in-person contact is essential for our social well-being and for the best of who we can be. But the power we've also seen by using this platform, we won't go back to where we were. We will continually use it. Secondly, we realize that probably there's a large number of our individuals who benefit and who actually are blessed by the fact that they can work from a home and remote space, and that they can actually be equally productive, have a higher quality of life if they're working from a remote setting. I think we'll probably continue that for selected groups as we go forward. And then I think that probably as much as anything, we have understood that the time that it's often taken in academic medical centers to get things done is not necessarily that long. We can make rapid changes, important changes in very efficient and quick ways when there is a true need to do it. So I think the culture of moving things through and making substantive changes to both infrastructure as well as critical needs, I think we will not be lost by leaving the lesson. We would be lost if we left the lesson, the lessons that we've learned about making change. And then the final thing is that I think we understand this idea of diversity, again, is really about at the core of us being our best. And that if we don't address it front and center, we'll never be able to move beyond some of the subtleties, but also some of the overt challenges we face as it relates to racism and inclusion.
What is the vaccination plan for School of Medicine employees?
The plan that I would like to have is for everybody vaccinated yesterday, but that's obviously not the plan that we face in reality. The plan follows in large part what the CDC had outlined, and that outline clearly highlighted healthcare workers, members of long-term care facilities, and we've done that at UAB fairly well. Those in the healthcare workspace have gotten their vaccines if they've desired so to have it. What we would like to do is to move into that 1B essential category, which would take care of almost all of our medical school as well as our campus community. And we're poised to do that. We've geared up the infrastructure. Dr. Nafsinger's leadership in this area, which has really been profound, has the ability to efficiently, as I mentioned, do over 1,000 vaccines a day. Our simple need are those vaccine doses. We're also actively reaching out in our state. Dr. Fernani, particularly, and myself and others, and Dr. Watts are doing all we can, as well as Dean Paul Irwin in the School of Public Health, are doing all we can with the State Department of Public Health to get these vaccines to our critical areas of need and get the doses we need so we can get our entire community vaccinated. My hope, like all, that the next vaccine approved, the Johnson & Johnson, a single dose, one, will have a similarly high effectiveness. Number two, that it will be ready to roll and the production will be as efficient or greater than what we've seen in Pfizer and Moderna. And we would have a third arm to now start moving the needle on getting individuals vaccinated. So we are working hard, not just hoping to make sure our entire community can get this, because we don't want to see any more lives lost. The final thing I would say is that short of that, we are working hard to make sure those who would benefit from the monoclonal antibody therapy can receive it. It clearly makes a difference. We've treated over 400 patients with it and have had only 5 to 7 people admitted, which is a remarkably low number when that antibody therapy is given.
How do you foresee the role of wellness in medicine adapting and expanding in 2021 as healthcare professionals continue to battle the mental health effects of COVID-19?
Yeah, I think it's going to be a partnership at multiple levels. I think systematically as an organization, as Dr. Rogers has promoted, we have to think about how do we create work environments that promote wellness, and how do we create structures and strategies that don't further create a decrement for wellness. Some of that's hard just because of the volumes that we deal with. Secondly, I think we have to continually provide programs and opportunities and services to support our house staff, our medical students, and our faculty and our employees. And then finally, I think we as individuals have to own our own well-being as much as we can. We have to be self-aware when we're becoming at risk, when we lose the disconnect, we lose the passion for caring for others, when we feel we're moving towards some level of burnout, we need to be aware of that and be willing to pull away and not ignore it. So I think it's all three of those levels that are going to be important for us going forward. It won't be an afterthought. It will be always front and center for us to be our best, because if our workforce are not at its best, we can't serve or achieve our goals.
How much longer are employees going to be working remotely? And when is the plan for remote work going to be published?
So that is still an ongoing process driven by how successfully we can get the vaccine rolled out. I would certainly think it's going to probably be through the spring. Hopefully after that time period, we can have a more formal plan that outlines for the university, outlines for the health system, where the school is attached in many ways to both, about what will be the final strategy for return to work or remain in a remote setting. So it's going to be with us for a time right now.
In light of this past year's showcasing of racial and political disparities that exist in the United States, what are we doing as an institution to recognize how our patients' health may be affected by the socioeconomic and political climate? And how are we teaching our students, residents, fellows, faculty, and other staff members to incorporate these disparities into how they practice medicine?
Yeah, so that's a great question. I think we first started by admitting and recognizing we have a problem. And it's not something that is, I would say, either made up or contrived, but it's real. I've said to people that in many ways, had George Floyd been the unfortunate victim in a southern town, this would have been perceived simply as a Alabama problem. The George Floyd's death in Minneapolis made it very clear that this is a problem for our country. And that speaks for Ahmaud Arbery, Breonna Taylor, all of those in those scenarios where bias and our previous past history that we've not completely dealt with as it relates to racism has been an area that's plagued us and certainly kept us from being our best. So first, understanding and being honest that we have an issue. Second, listening to our community and taking time to create proximity for both our majority and minority community, so there can be an understanding that our differences are far fewer than than the things that we have in common. Thirdly, it's then creating points of strategy to implement change. It's doing the activities that help create a different culture and getting the concern level, not only for those in our minority community, but a concern level that's equal by that of our majority community, for us not to be the same. And then monitoring it. Will Fernandes often says, as his father told him, we typically do what people inspect versus what we expect. We have to monitor what goes on and make it very clear that this is a priority for us to achieve our goals. And particularly, it's an important priority for us to lead the country in Birmingham, Alabama, where there is an unbelievably compelling reason for us to address this.
What are the specific strategic alliances, partnerships, and goals for the next 5 years with the VA? And who at the VA will drive this?
So we've had a long-standing relationship with the VA, and we've seen some benefits already during the vaccine distribution. We saw the benefits as it related to our health check and guide safe to make sure that they were critical partners. We've seen it as it relates to helping reduce disparities with the activities they do. And we see it on a regular basis for our faculty who really passionately serve. At the tip of the spear for us is Dr. Nupam Agarwal. He's our executive vice dean, but he is an active clinician at the VA, and in many ways helps us lead our activities related to research, related to clinical care, and related to unique partnerships that we can actually build upon. We've historically always helped pursue research infrastructure, and I think we'll continually do that. We'll continually pursue clinical shared opportunities to provide the best care for our veterans, and we'll also continually make sure that the educational platform at the VA provides the most outstanding training for our residents and students.
Considering undergraduates constitute a large part of the UAB system, how will vaccine rollout be determined for them to ensure the safety of UAB employees?
So there is Dr. Benoit and Dr. Lauren McMahon are leading a critical effort with Dr. John Jones to look at what will be the strategy to get our students vaccinated. And that's clearly a goal, and we won't be complete until we can get that done. So obviously we don't have the vaccines here yet. Obviously it's going to be later in the spring or later sort of in the March, April period, hopefully. It will be driven by hopefully the volume of production, but that plan is being placed. It's not fully developed, but it is being developed as we speak.
Since the goal of the School of Medicine is to rise to being in the top 20 of NIH funding, what can the School of Medicine do to bring the computational support at all levels, including research and administrative, to the standard needed for such a standing?
Yeah, I think it goes back to with that aspiration. And that aspiration is not just for a number or target. That aspiration is to create a really concentrated and comprehensive group of scientists that can sustain a significant impact in decreasing the burden of disease in this part of the world. It secondly becomes an attraction for continual talent acquisition for our community. It thirdly creates the economic impact that our city and our state needs. No one does that like UAB. To answer this question specifically, one of our new institutional cores is built specifically around this. This core looking at data sciences is critical for us, making sure that we continually provide that informatics critical infrastructure for the broader community. Fortunately or unfortunately, many of our labs have developed their own computational skills, but we realize that that's not sufficient. But we're recruiting. We continually support our Informatics Institute. We continually empower the CCTS. We've created a specific institutional core to help address this and grow this area. And we're exploring outside partnerships as well that I really can't speak in detail about, but that is on our radar, because we realize data sciences and managing the computational aspects of the data we have are huge. And that's the type of people who are going to need to fill the new genomic data science building.
While it is critically important to invest funds in new technologies, we must also support more basic research cores and services such as animal services and basic cores like the metabolism core. What strategies are being taken to address this problem?
So part of the strategies are clearly asking our community what cores are important. And I clearly have some cores in my mind, but we want to go on and have gone on what our community has made very clear. And I would say that we'll continually do that, and we'll continually add equipment and infrastructure to make those cores efficient, effective, and really best in class. Specifically about metabolism, Dr. Schleckman and I have talked about the relevance and the importance of this space. So it's an area that we're discussing with the Cancer Center, and we'll continually discuss and actually begin to think about strategies of making that not only a focus area for core growth, but particularly science development. So it's on our radar, but it also has to fit into the bigger picture of what we're doing.
Have you considered providing an incentive plan to encourage successful PIs who obtain NIH funding?
We have. We're crunching the numbers now. It's just a matter of what we can afford to do, but we recognize that this is an opportunity that we'd like to take advantage of. We know some departments have begun nascent plans, but our research leadership team, as well as with Lakeisha Mack, our Senior Associate Dean for Finance, are looking at that now. But we realize that no matter how much money we get, it never exceeds the demands. And so we have to make choices of priorities. But yes, this is something I've thought about and have desired in some significant way over the last 2 years. And we're looking closely to see if we can do this.
Are there any serious complications for an asymptomatic person that has COVID but is unaware that takes the vaccine?
Not that we know of. I think the question asked in some ways, if someone has the COVID virus or the coronavirus and they haven't had significant symptoms or damage, does that correlate to a lack of immune response? And I'm not sure that I can answer that except to say that the data doesn't point that there is any significant damage or risk if you take that vaccine if you are asymptomatic. Now, preferably when people who have been diagnosed, whether asymptomatic or symptomatic, we ask them to wait 90 days. But I don't think there's data to say there's undue harm if someone happens to take the vaccine within or before that 90-day period.
What has UAB done to address childcare issues for employees?
Yeah, so it's been a continual focus of our senior leadership, particularly led by Alan Bolton, and I know it's been a focus of Ray's as well as the schools. There have been multiple efforts looking at whether there should be some new center built, looking at providing slots for people at different care centers, but also looking how do we partner with other organizations who do this on a national level. And that's in part the pathway that we're going, to partner with national groups that do childcare and to potentially expand the spots and eventually, I suspect, build out an area that will grow the childcare centers that we have. I recognize, as well as others, that this is an essential aspect for the well-being of our faculty, staff, and employees. So it's a continual goal that we have, although not solved yet.
Is there any plan regarding family member vaccinations for employees?
Not as of yet. I get asked that every night by my wife. And so I'd like to see one, but we don't have one in place yet. Obviously, if a family member is a patient of UAB, they certainly can fit into that profile of getting on the list of UAB, where we have beginning to offer that to our patients.
Do you expect school of medicine classes to be held in person or virtual or a combination of both in the upcoming semesters?
I think in large part through much of the spring semester, they will be a combination. It'll be hybrid. It'll be virtual and hybrid. And I will say that because what we found is that in most cases, our students don't acquire or create a transmission vehicle while attending in space or on site in classrooms. Where their real risk is their behavior outside of the classroom. And that tends to drive the infectivity for our student population. So it'll be similar to last year, that it'll probably be a hybrid model.
Well, Dean Vickers, I've asked all the questions you're able to answer today. If you'd like to take a few moments to make closing remarks.
No, I thank again our communications team for the hard work they've done. But probably more important, I thank all of you who've chosen to be a part of this call and a part of this presentation. I can't thank you enough for what you've demonstrated to the world, to Alabama and Birmingham, how outstanding UAB is as an institution and School of Medicine. Thank you for the hard work. We clearly have not solved all the problems, but what we've demonstrated is no matter how big the problem is, we together can make an impact. Thank you very much.